So what happens when you come in for a biomagnetism session? This is what I wanted to explain to you. So you will come into the room. You are fully clothed. So you get to lay down. This is a nice heated massage bed, and we'll position you so your head is here and your legs, so it's going to take the pressure off of the lower back. Your legs are going to go up here, and I'm going to have your feet dangling off of the bed, just at the very feet. So we don't want any pressure on your legs. They're just going to free fall, but they will be, your back will be supported. So nobody that is laying here is straight out. They're very comfortable. They have the heat. And what I do, I'll usually go around them with like a sound bowl. Sometimes it just depends. I use my intuition as well, but I'll brush their body. You think of, all the dust that we can see on a sunny day, and it's coming in the window, and we see all that, the speckles in the air. Well, that is the same with our energy. There can be dirty energy just following us around. So this has a labradorite crystal on it, plus a quartz crystal. So it is my intention that I'm just kind of sweeping it clear. And I also use what's called a soap magnet as well, on the negative side, and just kind of sweep over the body. And it kind of just clears around the body and gives me a good starting point to work on. So what I'll do then, I will take a negative side of a magnet. We in biomagnetism, we refer to it as positive and negative. So on a magnet, there's no positive and negative. It's like a north and a south. But we refer to it as negative, and the south side is positive in magnetism polarity. So what we'll do, we scan on the right side of the body. The left side already has an electrical almost pump, if you will, because the heart is located on the left side. So when we scan, generally to find imbalances, we will scan on the right side of the body with a negative magnet. And so we'll put it in all different points. I'll come down and I will check the feet. I do have a few different biomagnetism shoes. These ones are from Dr. Garcia, and the toes, the front of them are cut off, so anyone can wear them. See, and they're just Velcroed on. Got some magnets on the bottom of them, and they will fit anybody. So, and we look at the heels. We're looking for a discrepancy of the heels, right? So if there is an imbalance, it's going to look like this. There's going to be one leg will voluntarily go shorter. So we look at that, and it depends. If it's this leg goes shorter, there's a contraction in the body. And if it's this leg that elongates, it's a relaxation, like something elongated. So it's either a constriction or a relaxation. And that tells us what side of the polarity of the magnet that we actually use. I just had a client today. She just left, and on the right side, like on the vagus nerve, we had to flip the polarity. So because her body wanted it, the positive polarity, so we had to flip that according to her body, and then her feet balanced. So it's really interesting. I do follow protocols. So there is a scanning protocol that you do, and you apply magnets as the body needs it. But there's also other protocols. So if somebody came in and they were, I don't know, they were just depressed. I can follow one for the emotions. And what if they were like full of anxiety and thinking very negative thoughts? We can actually work around the head area and try to balance that out with magnetism as well. So what this is doing is correcting the pH in the body. So every place in the body has that should be a normal pH level, 6.7 to 7.3. There's different places in the body. The stomach needs to be more acidic, obviously, but if there is too much alkalinity or too much acidity, like the acid part of the body, if there's too much, the drawing of the magnets is what makes it so there's like a push and a pull effect on the magnets. And when you get those spots in the correct places on the body to balance the feet, we leave it there for 30 minutes because it's pushing and pulling those ions, right? So if there's too much over here, this will kind of pull the ions away. So yeah, it's like a push